Learning through MCQs are one of the easiest and the best ways. Let's go ahead and learn through MCQs. All of the following are good prognostic factors of schizophrenia, except what do you think is the answer? It's good to know the good prognostic factors. Later onset, presence of a precipitating factor, acute onset, well adjusted premorbid status, prominent mood symptoms, compliance and tolerating medications well, family support and emotional support being there, family history of mood disorders, positive symptoms, they all make possibly good prognostic factors. If you know this, then what do you think is the answer? Insidious onset is the answer. Chronic onset or insidious onset is bad prognosis. If they had given acute onset, then it would have become good prognosis. Which of the following is are subcortical types of dementia? Now, you need to know what are the important subcortical types of dementia. Parkinson's disease, progressive supranuclear palsy, Wilson disease, Huntington's chorea, multisystemic atrophy. These are important subcortical types of dementia. Classically described cortical types of dementia are Alzheimer's disease and frontotemporal dementia. Frontotemporal dementia is also called as Pick's disease. So the answer is all the three, Parkinson's, Wilson's, and Huntington's, are subcortical types, whereas Pick's disease is a nothing but frontotemporal dementia, which is a cortical type of dementia. Antidepressants least associated with sexual side effects. Imagine there's a patient with depression where he's very concerned about his sexual functioning and doesn't want to take medications which causes sexual dysfunction. If these choices are given to me, mirtazapine, tricyclics, SSRIs, and dual-acting antidepressants like venlafaxine, duloxetine, what should I be choosing? You need to understand some of the safest antidepressants in terms of sexual side effects are bupropion is one of the best. Other drugs are mirtazapine, agomelatine, trazodone, vilazodone, and vortioxetine have also been told in some studies, but because they work on serotonin receptors significantly, you need to understand sometimes they end up actually causing sexual side effects by themselves too. So, answer is mirtazapine. But can you tell me what are two important side effects of mirtazapine? One is increased appetite and weight gain. Two is sedation. A middle-aged male lost his job a week back. He has been very irritable and sad, which worsens his mood. He, and this happens whenever he's discussing about job-related concerns. With this kind of a thing, he's kind of friendly with his friends. So, what is the most probable diagnosis? They've asked. Only one word is enough to tell the right answer. The word you should choose is he has lost his job a week back. If you know what all conditions happen within a week, what all conditions require more duration, you'll tell the answer. Next important point is mental illnesses which require life event are acute stress disorder, adjustment disorder, post traumatic stress disorder. With these two pieces of knowledge, the duration and some important mental illness which specifically require a life event are these conditions. So, what is the answer? Answer obviously is adjustment disorder. Why did I mention about duration? Adjustment disorder is something which starts with a life event and will maximum stay for a period of 6 months. Whereas the other conditions which are given in the choice, like GAD, requires minimum 6 months of symptoms for you to diagnose GAD. Whereas the other two conditions, mixed anxiety and depression disorder and moderate depression, require 2 weeks of minimum symptoms for you to actually diagnose these conditions. A child has been diagnosed to have primary enuresis. What should be the initial treatment plan? Primary enuresis, bedwetting is a common problem. Nocturnal enuresis is a common problem in some kids, right? So it's important for us to understand. They also asked what is the initial treatment of plan. First of all, let me tell the most important ways of managing primary enuresis. First important point is we give a basic advice about bladder habits, training, and reinforcement. We want the family members to reduce unnecessary criticality, kind of support the child, build up the self-esteem, also teach healthy bladder habits and train if possible. Next important thing is If at all it's quite bothersome, we have to intervene. Then two intervention strategies which are equally effective are alarm system and desmopressin. Imipramine is also tried, but imipramine is a tricyclic drugs, has its own side effects, so it's better to avoid as much as possible. So desmopressin, if at all you want to try in pharmacotherapy, is better drug, and it is drug of choice in primary enuresis. With this understanding, tell me what is the answer. The important point you need to understand is they've asked initial treatment. So I would go ahead and choose bladder training and reinforcement compared to alarm system for a simple reason is because even though bladder training does not have much of evidence to say it's really effective, bladder training becomes a part of routine advice which is given, which is the initial thing which is done, much more compared to alarm system or pharmacotherapy, which is the next step of the whole intervention. So the word initial treatment makes me choose bladder training and reinforcement, even though the alarm system and pharmacotherapy, especially desmopressin, are equally effective interventions in primary enuresis. A patient with severe depression is treated with tricyclics and is being discharged. So they ask what is the concern here. Please understand, tricyclic antidepressants are pretty dirty drugs. It works on muscarinic receptors, it works on the sodium channels, it works on the calcium channels. So, being a dirty drug, it is known to cause a lot of side effects. Sedation, cardiac arrhythmias, and the importance of therapeutic level are also to be looked at. But what is important here? They've also given another point, planned to be discharged. A patient who's planned to be discharged. If you've read about suicide, you know one point of time where there is increased risk of suicide is when you start medications. Another point of time where you should be potentially looking for an increased risk of suicide is post discharge, immediately post discharge. So with this understanding, tricyclics being kind of dirty drugs causing a lot of problem, and I hope you also know that tricyclics have a quite a lethal effect. So even small overdose can lead to death. So, with this understanding of increased risk post discharge and tricyclics being dirty drugs, what do you think is the best answer? Overdose should be the most important concern. So, it's a good idea for us to give the medications to the family members and ask them to monitor the dosage being taken rather than having full access to the patient sometimes because they might end up accidentally or deliberately overdosing themselves and we might lose the patient. A child about 10 years has selective mutism is probably suffering from what? What do you think is the answer? The child has selective mutism. What is selective mutism? The child is not talking to some people, whereas the child talks to some other people. Most of the times, these children talk to very familiar people, that is, their own family members. But strangers, school environment, or any other environment, they might find it very difficult to talk to others. That's what is called as selective mutism, where they select and mute themselves. That is quite common in children. Now, this can transitorily happen in children when changes in environment happen. Many a times it can also happen when children join schools, change schools, all those kind of stuff. But here they've asked, what is the child mostly suffering from? The child can suffer from depression, anxiety, psychosis, any of the three things which can lead to selective mutism. But most important one is to always rule out anxiety because a lot of children with social anxiety disorder and those can present with selective mutism. So anxiety is the most important one which could be possibly happening in these children with selective mutism. By the way, can it happen in hyperactivity? Definitely you should not consider it as a choice at all for a simple reason because in hyperactivity the reverse happens. The children are over familiar, talk more, might have less inhibition, so they can kind of get into talking to even strangers much easily, risk taking, novelty seeking. Those are all very characteristic of hyperactivity behaviors, ADHD children. So with this understanding, what is the answer? I would choose anxiety as the answer for this question. A psychotic patient presents with posturing, negativism, waxy flexibility. What is the appropriate medical management here? So the question talks about posturing, negativism, waxy flexibility. Where do you see all these things? Obviously, you've seen catatonia, right? Now, if you have understood this much, then you will say the answer obviously is lorazepam, because you need to understand for catatonia management, two main strategies. One is ECTs, electroconvulsive therapy. Another one is using lorazepam. A lot of patients, they call it as a lorazepam test or lorazepam trial test. What do you mean by that? Any patients where you suspect catatonia and you want to see whether it is catatonia or not, if you start the patient on lorazepam, generally within the next 48 hours they will respond if it is catatonia. So that's a good test for you to say whether the patient is actually having catatonia. So answer for this question is lorazepam, which is preferred. Now I have an interesting question here. Where do you think lorazepam can be used, propranolol can be used, triacylphenidine can be used? All the three given here on this slide can be used: lorazepam, propranolol, and triacylphenidine. In which condition, which is related to psychiatry or psychiatric drugs adverse events? Anything? Anybody? Any answer? I hope you have thought of this condition called akathisia. Very good. In akathisia, you can use benzodiazepines, you can use propranolol beta blockers, you can also anticholinergic like triacylphenidine. If they give all the three and ask you what is the treatment of choice for these patients, the answer for patients treating with akathisia is propranolol. That's the best out of the lot. With this, I think we have kind of understood a lot of important salient points related to the MCQs in a recent exam. Thank you.